Diclofenac, a multifaceted drug beyond pain relief. Diclofenac is a widely used medication. It is a non-steroidal anti-inflammatory drug, or NSAID. It is prescribed for pain relief and reducing inflammation. Diclofenac is effective for conditions like arthritis, menstrual cramps, and injuries. It works by blocking COX enzymes. COX enzymes produce prostaglandins. Prostaglandins contribute to pain and inflammation. Diclofenac is a versatile drug. It has shown promise beyond its traditional uses. Recent research indicates it has potential in cancer treatment. This is due to its ability to inhibit glycolysis. Glycolysis is the process of converting glucose into energy. Cancer cells rely heavily on glycolysis for rapid growth. Diclofenac's dual action is remarkable. It targets both inflammation and cancer cell metabolism. This makes it a valuable candidate for developing new cancer therapies. It is important to note that diclofenac is not a standalone cancer treatment. However, its unique properties make it a promising addition to existing therapies. Further research is necessary to explore its full potential. Understanding its mechanisms and effects will pave the way for innovative treatment approaches. This could lead to improved outcomes for cancer patients. Inhibiting inflammation. Diclofenac's primary mode of action. Inflammation is a natural process. It helps our body heal and fight off infections. However, chronic inflammation can be harmful. It contributes to various diseases, including cancer. Diclofenac effectively reduces inflammation by targeting COX enzymes. COX enzymes exist in two main forms, COX-1 and COX-2. COX-1 is involved in protecting the stomach lining. COX-2 plays a role in inflammation. Diclofenac primarily inhibits COX-2, reducing the production of inflammatory prostaglandins. By inhibiting COX-2, diclofenac alleviates pain and swelling. This makes it beneficial for conditions like osteoarthritis and rheumatoid arthritis. It can also be used to manage pain after surgeries or injuries. Diclofenac is available in various forms, including tablets, capsules, gels, and injections. While generally safe, diclofenac can cause side effects. The most common are gastrointestinal issues, such as heartburn, nausea, and stomach ulcers. Long-term use can increase the risk of cardiovascular events. It is important to use diclofenac under the guidance of a healthcare professional. Diclofenac, a powerful ally against cancer cell metabolism. Cancer cells have different metabolic needs than normal cells. They rely heavily on glycolysis for energy, even in the presence of oxygen. This is known as the Warburg effect. Diclofenac has emerged as a potential weapon against cancer by disrupting this metabolic pathway. Diclofenac acts as a glycolysis inhibitor. It does this by targeting monocarboxylate transporters, or MCTs. MCTs are proteins that help transport lactic acid, a byproduct of glycolysis, out of cells. By blocking MCTs, diclofenac traps lactic acid within cancer cells. This buildup of lactic acid creates a toxic environment. It disrupts the pH balance within the cell and inhibits further glycolysis. As a result, cancer cells are deprived of energy and their growth is suppressed. This metabolic disruption makes diclofenac a promising candidate for cancer therapy. Diclofenac's ability to target cancer cell metabolism, combined with its anti-inflammatory properties, makes it a unique and valuable tool in the fight against cancer. Furthermore, its well-established safety profile and availability make it an attractive option for further research and clinical trials. Starving cancer cells. How diclofenac disrupts energy production. Cancer cells are notorious for their rapid growth and proliferation. This requires a tremendous amount of energy. Glycolysis, the breakdown of glucose into energy, is a key metabolic pathway that fuels cancer cell growth. Diclofenac effectively disrupts this process. Monocarboxylate transporters, or MCTs, are essential for glycolysis. They export lactic acid, a byproduct of glycolysis, from the cell. Diclofenac acts as an MCT inhibitor, specifically targeting MCT1 and MCT4. These transporters are often overexpressed in cancer cells. By blocking MCTs, diclofenac prevents the removal of lactic acid. This leads to lactic acid accumulation within the cancer cells. The increased acidity disrupts the cellular environment. This hinders energy production and slows down tumor growth. Diclofenac's impact on cancer cell metabolism is significant. It not only starves cancer cells of energy, but also triggers their death. This makes it a promising candidate for developing new cancer treatments. Further research is crucial to explore its full potential in various cancer types. Section 5. Dr. Eva Gottfried's groundbreaking research on diclofenac. Dr. Eva Gottfried, a renowned cancer researcher, has made significant contributions to understanding diclofenac's anti-cancer properties. Her research has shed light on the drug's ability to target cancer cell metabolism and enhance immune responses. One of Dr. Gottfried's key findings is the impact of diclofenac on CMYC expression. CMYC is a protein that plays a crucial role in cell growth and proliferation. It is often overexpressed in cancer cells, driving their uncontrolled growth. Dr. Gottfried's research revealed that diclofenac effectively inhibits CMYC expression. Furthermore, her studies have demonstrated that diclofenac reduces glucose uptake in cancer cells. Glucose is the primary fuel source for cancer cells. By limiting glucose availability, diclofenac effectively starves cancer cells and inhibits their growth. Dr. Gottfried's research has also highlighted diclofenac's impact on lactate secretion. Lactate, a byproduct of glycolysis, is secreted by cancer cells and contributes to tumor growth and immune suppression. Diclofenac's ability to reduce lactate secretion further strengthens its anti-cancer potential. Dr. Gottfried's groundbreaking research has paved the way for further exploration of diclofenac as a potential cancer therapy. Her findings provide a strong foundation for future clinical trials and the development of new treatment strategies. Section 6. A powerful combination, diclofenac and metformin in glioblastoma treatment. Glioblastoma is a highly aggressive type of brain cancer. It is known for its resistance to traditional therapies. Researchers are constantly seeking innovative approaches to improve treatment outcomes. Combining diclofenac with metformin has emerged as a promising strategy. Metformin is a widely used drug for type 2 diabetes. It has gained attention for its anti-cancer properties. Metformin works by inhibiting mitochondrial respiration, another energy-producing pathway in cells. Combining metformin with diclofenac creates a dual attack on cancer cell metabolism. This combination targets both glycolysis and oxidative phosphorylation, or OXPHOS. Glycolysis occurs in the cytoplasm, while OXPHOS takes place in the mitochondria. By inhibiting both pathways, the combination effectively starves cancer cells of energy, leading to their death. Studies have shown that the combination of diclofenac and metformin is more effective than either drug alone in inhibiting glioblastoma cell growth. This synergistic effect provides a strong rationale for further clinical investigation. It offers a potential new avenue for treating this challenging cancer. Section 7. Boosting immunotherapy. Diclofenac enhances checkpoint inhibitors. Immunotherapy has revolutionized cancer treatment. Checkpoint inhibitors, a type of immunotherapy, work by unleashing the body's own immune system to attack cancer cells. However, not all patients respond equally to checkpoint inhibitors. Researchers are exploring ways to enhance their efficacy. Diclofenac has shown promise in augmenting checkpoint inhibitor therapy. Studies have demonstrated that combining diclofenac with anti-PD-1 therapy improves treatment outcomes in melanoma, a type of skin cancer. PD-1 is a protein that helps regulate immune responses. Diclofenac enhances the activity of T cells, a type of white blood cell that plays a crucial role in immune responses. By boosting T cell activity, diclofenac enhances the effectiveness of checkpoint inhibitors. This leads to a more robust immune response against cancer cells. The combination of diclofenac and checkpoint inhibitors offers a promising approach to improve cancer treatment. This synergistic effect could potentially benefit a wider range of cancer patients. Further research is needed to determine the optimal combination strategies and potential benefits for different cancer types. Section 8. Diclofenac's potential in lymphoma and leukemia treatment. Lymphoma and leukemia are cancers that affect the blood and lymphatic system. They are characterized by the uncontrolled growth of white blood cells. These cancers can be challenging to treat, and researchers are continuously exploring new therapeutic options. Diclofenac has shown potential in preclinical studies for treating lymphoma and leukemia. Its ability to inhibit glycolysis and induce apoptosis or programmed cell death in cancer cells makes it a promising candidate for further investigation. Specifically, diclofenac has demonstrated efficacy in targeting pathways crucial for the survival of lymphoma and leukemia cells. By disrupting these pathways, diclofenac can potentially inhibit the growth and spread of these cancers. While further research is necessary to determine its clinical effectiveness, diclofenac's potential in treating lymphoma and leukemia is encouraging. Its ability to target specific vulnerabilities in these cancer cells makes it an attractive option for developing new therapeutic strategies. Section 9. Beyond internal cancers. Diclofenac for actinic keratosis. Diclofenac's therapeutic benefits extend beyond treating internal cancers. It has also shown promise in managing actinic keratosis, a precancerous skin condition. Actinic keratosis appears as rough, scaly patches on the skin. It is caused by prolonged exposure to ultraviolet radiation from the sun. Topical diclofenac, available as a gel, has been approved for treating actinic keratosis. It works by reducing inflammation and promoting the death of abnormal cells. Clinical trials have demonstrated the effectiveness of topical diclofenac in clearing actinic keratosis lesions. While topical diclofenac is generally safe, it can cause mild side effects such as skin irritation, redness, and dryness. It is important to use it as directed by a healthcare professional. Diclofenac's effectiveness in treating actinic keratosis highlights its versatility as a therapeutic agent. Its ability to target abnormal cell growth extends beyond internal cancers, making it a valuable option for managing precancerous skin conditions. Section 10. The Balancing Act. Weighing the benefits and risks of diclofenac. Diclofenac, like any medication, comes with potential benefits and risks. While it offers promising therapeutic effects for various conditions, including pain relief, inflammation reduction, and potential anti-cancer properties, it is crucial to use it cautiously and under medical supervision. One of the primary concerns with diclofenac is its potential for gastrointestinal side effects. Long-term use can increase the risk of stomach ulcers, bleeding, and other complications. Patients with a history of gastrointestinal issues should use diclofenac with caution. Diclofenac can also impact cardiovascular health. It may increase the risk of heart attacks, strokes, and other cardiovascular events, especially with long-term use. Patients with pre-existing cardiovascular conditions should consult their healthcare provider before using diclofenac. Furthermore, diclofenac can interact with other medications, potentially leading to adverse effects. It is essential to inform your healthcare provider about all the medications you are taking, including over-the-counter drugs and supplements, before using diclofenac. Careful patient monitoring is crucial during diclofenac therapy. Regular checkups, blood pressure monitoring, and assessment for any side effects are essential to ensure safe and effective use. By carefully weighing the benefits and risks, healthcare professionals can make informed decisions about prescribing diclofenac and optimize patient outcomes. Section 11. Conclusion. Diclofenac's promising future in medicine. Diclofenac, a widely used NSAID, has emerged as a promising candidate for various medical applications beyond its traditional use in pain and inflammation management. Its unique ability to inhibit both COX enzymes and glycolysis makes it a valuable tool in the fight against cancer and other diseases. While further research is necessary to fully elucidate its mechanisms of action and potential benefits, diclofenac's ability to target cancer cell metabolism, enhance immune responses, and manage precancerous conditions is encouraging. Its well-established safety profile and availability make it an attractive option for further clinical investigation. However, it is crucial to acknowledge the potential risks associated with diclofenac use, such as gastrointestinal and cardiovascular side effects. Careful patient selection, monitoring, and risk mitigation strategies are essential to ensure safe and effective use. As research progresses, we can expect a deeper understanding of diclofenac's therapeutic potential and its optimal use in various medical fields. The future of diclofenac in medicine appears promising, with the potential to improve patient outcomes and address unmet medical needs.